Welcome back. Do you remember those tiny, itchy red bumps on your skin as a kid? Many of us have fond memories of chicken pox. Once you get them, you're good for life, right? Well, you may not get chicken pox again, but you could get shingles, which is often more painful and can be long-lasting. Joining me now, our doc on call, Dr. Ryan Stanton, here to answer this week's viewer question, which comes from Crystal. She asks, who should be getting the shingles vaccine and how well does it work? Doc, I guess, first of all, just give us a quick background on what shingles is.
Yeah, young folks have never really gotten to experience the whole chickenpox excitement.
True.
So shingles is the reactivation of the chickenpox virus known as herpes zoster. After the infection, the virus hides out typically in one nerve root in the body and then hangs out there for the rest of your life. This is one of those infections I will call a kick you while you're down ailment. It tends to reactivate when people are elderly and some sort of knock to the immune system, such as an infection, significant stress, or cancer treatment, cause that immune system to drop off and actually allows this to reactivate. When it reactivates, it starts as a sensitivity and burning pain in the skin, followed by a rash that develops in the distribution of the nerve, which it's been hiding in, almost like a half narrow band distribution around like part of the chest or down the leg or down the arm. Not only is it painful, but it can cause complications, most common of which is the pain in the region known as postherpetic neuralgia, meaning pain of the nerve, but can also spread chickenpox to high-risk patients such as non-immunized or under-immunized populations. So let's get some stats on the shingles. 1 in 3 people will get shingles during their lifetime. The symptoms typically will last about 2 to 4 weeks, that's if you're lucky, but pain can persist for weeks if not months or longer, especially if you're one of those 30% of patients who develop the postherpetic neuralgia.
Okay, so 1 in 3, that's pretty high numbers. So who should be getting the vaccine?
So the vaccine, there's currently one vaccine available, and since the risk increases with age, that follows along with the recommendations. So who should get the vaccine? Number 1 is going to be patients age 60 and older. That is going to be, we don't want it to do too early, because if you get it too early, then it's actually going to wear itself out. Number 2 is 99% of people over age 40 have had the chickenpox, so you are definitely at risk. The vaccine itself reduces the shingles risk by about 51%, reducing the herpetic neuralgia down by 67%. And if you don't think those numbers are really good, then you haven't had shingles yet.
Yes.
Because it is an incredibly painful and uncomfortable type of diagnosis and affliction that most people who've had it before would do anything not to have it again.
Yeah, the people I know who have had it, I mean, these pictures alone, look, it looks super painful. But the people I know who have had it, I mean, they are out for the count. They're down for a long time, and not just, you know, the irritation of it, but really just the pain.
Yeah, absolutely. The pain is the big thing, and the most important thing for you is if you get this, see your doctor right away and start the treatments that may help recovery. It's not like an off-on switch, it'll make it go away. Also, the person needs to stay clear of non-immunized, the young children that haven't had the chickenpox vaccine yet, immunocompromised folks such as those with HIV or cancer, and of course, pregnant women. The treatment here is not a cure. Okay. It's not a cure at all. In fact, you're still going to deal with the virus the rest of your life. This just knocks down and decreases those chances, hopefully improving the chances of recovery, and more importantly, preventing the chances of that chronic herpetic neuralgia that can plague people and really cause some issues down the road.
So we talked about how younger generations now have that chickenpox vaccine. Is this something that will eliminate shingles down the line for them too?
That's a question. We don't know.
Okay.
Now the shingles vaccine, excuse me, the chickenpox vaccine is a live attenuated vaccine. That means that it has live virus in it. So theoretically it works the same way, that it can hide out in the nerves as well, but we don't know. It's that age group under 40, so I'm right on that border of, I had chickenpox, but people within a few years after me had the vaccine, and so we don't know how that's going to play out down the road, but I imagine there still will be a risk due to the actual vaccine itself that you could get shingles, because basically all the vaccine for the chickenpox has done is fool your body into thinking it's had it all right already, so it goes ahead and makes that immune response.
Okay. All right. Well, interesting to see what the future generations
see how it plays out next 20 years.
Exactly. All right. Well, if you have a question for Dr. Stanton, like Crystal did today, you can go to his Facebook page, Stanton MD, and ask your question there. We may feature it next week. We're back with more right after this.